welcome back to Spencer FYI. And in our series of behavioral health, we're going to talk with Dr. Plucker-Billups today. And thanks so much for joining us today.
Absolutely, it's my pleasure.
Tell me a little bit about yourself, where you work, and kind of what it is that you do.
Yeah, so I am a psychiatrist. That means that I'm a medical doctor. I work at Spencer Hospital, and I'm the medical director of the Behavioral Health Services department there. And so that includes both inpatient behavioral health services and the outpatient clinic.
Alrighty. Well, let's talk. We're going to talk a little bit about behavioral health and dealing with a disaster and things like that. So, to start off, maybe what are some signs that a person should look for if you know, friends or family or themselves are kind of struggling with their health, mental health?
Absolutely, and so important right now given the events recently here in Spencer and the larger community. And so I kind of break it down into two categories. One is looking internally at your mood states. So, you know, checking in with yourself. Everybody's going to have some instances where they're in a negative mood, right? Iowa lost, Iowa State lost. You're frustrated, you're irritable, you're on your way to work, you're late, you're worried. But it's when emotions like sadness, like irritability, like anxiety are more prevalent in your life and you feel like it's maybe harder to get them off your back, or they're really negatively impacting just your enjoyment, then it's maybe time to think about, maybe I ought to reach out to someone and get some help. So number one is checking in with yourself about just your mood. But also I think checking in with your behavior, because sometimes it's really difficult to actually, you know, stop and say, I'm feeling this way right now, I'm feeling that way. I mean, you're running around with the kids, you're making dinner, you're trying to, you know, clean up after the flood. And so then it's important to look at your behaviors. Are you still participating in the things that you enjoy? Are you still going to those community events? Are you still going to your kids' plays? Are you still going to those family get-togethers? If you're not and you're starting to withdraw, that's a sign that maybe you might need some help maintaining your mental health. If you're not sleeping like you normally do, that's also a positive indicator that might need some help. And then certainly if there's any kind of escalating use of substances like alcohol or any other drugs, that's a telltale sign that maybe you're trying to self-medicate, and self-medicating is not something that we recommend, and so we would ask you to reach out.
So as a person outside and you're seeing this on somebody that's a friend or a family, what's the best way to maybe approach that or to kind of, you know, help them?
Yeah, so absolutely. I think it can be very difficult to approach that situation with someone that you're concerned about, but you don't want to come off like you're prying or, you know, like you're accusing or anything. And so I find it helpful to use I statements in that instance. So I might say to a friend or family member, you know, when the flood hit, I felt, you know, really a lot of fear, or I felt, you know, anxiety, or I felt some sadness, or I felt grief. And I was able to talk to somebody about it, and that helped me. Or, you know, I re-engaged in this hobby, and that helped me. And I want you to know that if you are ever feeling like you want to talk about anything, or if you're ever struggling, I'm here for you because I care about you. And that just kind of opens it up to, all right, I've opened up, right? And now it gives you the space to feel comfortable opening up to me, and without the pressure to do so, but just the opportunity. So I think that's a good way to address it.
Then if you feel that they maybe need more help, is there a good way to broach that subject?
Yeah, so I think if they need more help, I always think it's best to give them options and then to allow them to first explore that themselves if they think they need it. So with the resources in the community, I mean, we have our behavioral health clinic right in town. There's therapy resources in the community. LINC has done a very good job at kind of coalescing some of the resources and putting those all in one place. So directing them to those services and trying to allow them to decide what might be helpful for them. Now, it's different if someone is having thoughts that could harm themselves or others. If that's ever the case, that's an emergency, just like any other emergency. You know, let's say you're having a heart attack, you'd go to the hospital, right? Because a heart attack can kill you, okay? Suicidal thoughts, thoughts to hurt other people, things like that, that's an emergency too. and at that point, you need to help them get to the hospital. But hopefully that won't be the case, and you can give them the resources, and then they can pursue that.
Let's maybe talk a little bit about, we've heard a lot about the survivor's guilt and the folks that weren't affected, and they, kind of what are some things that you see with that, and how can you help someone that's kind of going through that?
Yeah, absolutely. So survivor's guilt, first of all, I think humans are very complex, and we have complex emotions. And oftentimes we have two differing emotions simultaneously. In fact, almost all the time we do. And so survivor's guilt really is a normal response to a disaster in a community. So it's simultaneously feeling deep empathy, compassion, concern for those that were devastated in some instances by these events, while also feeling thankful for and appreciative for what you have, and that it wasn't as bad as it could have been for you. So those are conflicting, and that's difficult to manage sometimes. But first, I just want to say it's normal. It does get better with time. Some things that I think can help survivor's guilt are just reaching out to those that were affected and allowing yourself to give them time. So your time. So essentially, that could be just lending an ear to them, listening, right? Supporting them, reassuring them. And then it could also be practical things like helping them clean up, like donating, like helping them with everyday tasks, maybe making some meals for them, things like that. I think that's important. Yeah.
So what are some normal feelings maybe that folks will have short-term, long-term, whether they were affected or weren't affected? Maybe something that, that we're, a month or so out here. Mm-hmm. Should we still be feeling what we were feeling before?
So great question. So everybody's timeline is different, and there is no right way or wrong way to deal with a disaster or the emotions that, are the fallout from the disaster. I mean, in the acute period, which I believe we're still in, I mean, you may be feeling all kinds of things. Shock, right? Maybe, how could this happen in this community? You might be feeling grief. People grieve really the sense of losing their lives, really the sense of normal, will it ever be normal again? So then you have anxiety about the future as well. And then people can get angry and frustrated that this happened. Those are usually secondary emotions to sadness or to grief, but yet they're difficult to deal with. The hope over time is that those acute emotions will translate and transition into resilience, will transition into an appreciation and growth as an individual, and really kind of coalesce and make the community stronger as a whole. But if those emotions are persistent, and those emotions are starting to really intervene in your personal interactions or intervene in your day-to-day or just how you feel about yourself, then I think it might be time to reach out and get some help to process through that with someone who is a professional.
So there's really no timeline. So, I mean, you're going to just kind of go through those stages on your own time.
Yeah, it's going to be your own time, and really, because there's no right or wrong way to do this, it's really up to you, right? So if you are feeling distressed by the emotions that you're feeling, and you are feeling like they are negatively impacting your life, then you should get help. And it doesn't matter if, Jack down the block didn't need to go, or, Susie doesn't think that it's going to help. If you're going through it, then you deserve to feel happy and healthy. And the process to getting back to that place might be, a journey, but I think it's one that can really be accelerated with the help of a mental health professional.
All right. So let's talk a little bit about then what you guys can offer at the hospital.
Yeah, absolutely. So we at the hospital, we have both inpatient mental health services, and that's really for the more acute side of mental illness. So if a person is a risk to themselves, if a person is a risk to others, or they're just not functioning in their life, in their community, it's hard for them to take care of themselves, things like that. The best way to get to those services is to go to the emergency department, call 911, and we can get get those services, pretty rapidly here in rural Iowa. So that's good. And then we also have the outpatient side, which is the clinic, and they see really everything from milder cases of mental illness, or maybe just kind of what we would call an adjustment disorder, right? Something bad happened, and I'm struggling to deal with it, right? So they see all on that side, and they also see more severe and chronic cases of mental illness as well. And we can offer not only just talking through things, kind of the therapy aspect, but also medications. And I think medications are a huge resource to people. You don't have to be on medications forever. You don't have to be on any, right? But if you need them, you need them. And you need them for how long you need them, and then you don't, maybe, So and that's an individualized treatment choice between the provider and each patient. So yeah, so we offer those services, and we could be referred to those services through your primary care provider or by calling our clinic directly.
All right. So that was my next question, is if they needed a referral or not. So you don't necessarily need one, you can just call the number.
Don't necessarily, yeah. If you do have a primary care doctor in the area and you're thinking that, you might want to be referred to behavioral health services, I think that's a little easier route, but certainly calling the clinic directly and setting up a new patient appointment is also an option for you.
Anything else that you want to add that I didn't ask about, or that you want to make sure you touch on?
Yeah, so I would just say, this is an extremely trying time in everyone's life. And once again, there's no right or wrong way to address it. I would just say, if you are feeling overwhelmed, if you're feeling overworked, if you're feeling stressed, allow yourself the permission to take care of yourself. Allow yourself to say, if I haven't been out with my friends for a little while, I'm going to go do that, and I'll get back to the house later. If I haven't been, to the park with the kids in a while, I'm going to take the kids to the park, and that's okay. Or if I just want to take a nap, I'm going to do that. Yeah, and that's part of the healing process. So.
Yeah. All right. Well, thanks so much for taking some time to talk to us today, and hopefully, if you feel like you need this, reach out, right?
Yeah, absolutely. Please do.
Awesome. Thank you.
Thank you.
We'll be back with more right after this.